My name is Dr. Pierre Felix. Um, I am 59 years old with high blood pressure, and a couple of years ago, I had an A1C of 5.7, so I was told I was pre-diabetic. So I've been trying to get healthy by losing weight to improve my blood pressure and improve my A1C.
So tell us about your experience so far with GC Healthy Living.
My experience so far that the program has increased my intensity of exercise and it has lowered my blood pressure after the workout. I've seen a significant improvement on my blood pressure. The first workout, my blood pressure beforehand was 158 over 106. And after the workout, my blood pressure was rechecked and he dropped to 128 over 66. That's never happened. I've never seen my blood pressure normal ever. It's improved in the past with blood pressure medication, but has never normalized.
It's incredible. So tell me now that so you first came for an assessment, you come to a group class, and now you're starting with some personal training and lifestyle coaching.
Mhm.
And how is this starting to change your perspective as a primary care physician about how we should be talking to our patients about lifestyle?
It's helping me to uh, view the nutritional status and helping patients understand the importance of not skipping meals. One of the things that I learned from the healthy living, I used to practice intermittent fasting. And after talking to Coach Eddie, who described the pitfalls of intermittent fasting, I decided to start taking in some protein at breakfast. And this morning, for the first time, I ate eggs like Coach Eddie recommended. And my performance was so much better. I feel so much better as opposed to the last time I worked out. I was fasting, I didn't eat breakfast. A lot of my patients have been skipping breakfast and doing fasting, and healthy living has taught me to be careful with that it's important to consume protein and to make sure you get adequate protein in your diet even early in the day.
So now, how long have you been practicing medicine, Dr. Felix?
I've been practicing medicine since 1997, so 29 years total.
And what are your thoughts on how we can start to reform our medical education and how our physicians, nurse practitioners, PAs, and primary care are taught about what is actually a healthy lifestyle?
So I think healthy living, what I've learned is that we need to have a holistic approach to educating our patients, not just prescribing medications. And we need to discuss diet, exercise, and not just telling patients to go exercise and telling patients to eat healthy, but we need to be more specific and discussing the amount of protein that patients should be intaking and the amount of exercise, and specifically whether the exercise should be cardio, resistance training. We need to be more specific and educating our patients about the amount of exercise and the type of exercise and the intensity as well.
Eddie, could you talk a little bit about how you connected with Dr. Felix and were able to build a relationship that allowed him to feel comfortable to start working with you?
So I spoke with Dr. Felix in Lawrenceville. I saw him in the regular shift with a 10 patient. And I started to talk to him how I can improve his lifestyle. He talked to me how I can be better in the exercise. The times, every time one limited for all our physicians. So I explained how it can be better in only 10 or 15 minutes, limited time, how it can be really like successful and effective. So after that, we are agreed with like a round assessment. The assessment, I check everything with Dr. Felix, baseline in terms of flexibility, balance, strength, cardio capacity. And then we break down his lifestyle. He mentioned he was fasting for like a religion and for a proper option. So then after that, I recommend how it can improve your protein intake, how it can break down 3 meals per day and improve your protein intake for build this kind of like structure in his life. So yeah, after 2 classes today, he improved a lot of the numbers. And the most important for me, first of all, is the safety measure to how it can improve his lifestyle and how it can measure the regular like a blood markers and condition. In this case, the blood pressure after working out. So he, like physician, can notice what the physiology is going and how the CrossFit methodology is effective in his body.
And tell us a little bit about how you think other coaches or really experienced people who understand the physiology of CrossFit and are understanding of the methodology and why it works the way it does could come to do what you've done, which is connect with people who are at a high level in the medical field and start to show them that there is a different way to have a healthy lifestyle.
So I think it's a really important component is feel comfortable with your knowledge. So if you are experienced coach, you have knowledge, if you have research, you know about physiology, anatomy, the basic line, and definitely CrossFit helped us in the sickness, wellness, fitness continuum and explain how you can like see these markers and then using your patient. And so with all your experience with the correct program and with the correct amount of exercise, definitely you can make difference in everyone. So we can have this gap and this bridge between physician and coaches, and definitely we can make experience.
And I think one thing when we started coaching in the clinic and bringing training opportunities into the clinic was we really want to build a community. And I'm really happy because I think now we have physicians in the community. Dr. K was the first one, and it's growing. We have staff in the community, and we have patients. And then with our community events, even their family members. And I want to hear from both of you, and then we can conclude is what are other ways you think we can create a culture of healthy living within the practice?
For myself, I think the most important is everyone need like a live in on person how's the movement, how they can feel after working out, because you can speak or you can like show different things in the paper, but in the final day when you're like a field experience, when you fill out the break, when you feel the exercise, then you can mention or apply your experience.
What do you think about that, Dr. Felix?
Yes, I think we can improve the community aspect by organizing a healthy living exercise workout for the community and certain weekends where
CrossFit workout.
yes,
I like
so
that idea.
yeah, I think that would help.
I love that you mentioned that because I think that the experience of doing a workout, even if that people are different levels or they're using different weights or modifying, that experience of doing the workout together, starting at the same time, finishing around the same time, it really does help build community. And it's something we really need in medicine. So thank you so much, Dr. Phillips. Thanks, everyone.
Thank you. Okay, blood pressure, go with me.